No, what I'm afraid of is having babies not have brains. I'm afraid of having a patient who has a pregnancy that they so desire, and 20 weeks into that pregnancy, we have to tell them that their baby doesn't have a brain or a skull. And then hopefully they live in a state where they even have options, and say that they decide to continue their pregnancy. So for another 20 weeks, they have to live through being pregnant with a baby that they know is not going to survive. And then they probably have to be induced because babies without brains or skulls typically don't start labor the way they're supposed to. So then we have to induce you, and then you have to birth your baby, and then you have to watch your baby pass away on comfort care. And so that's what I'm afraid of. I'm afraid of my patients going through that. You think I'm afraid of being sued for talking about folic acid, the substance recommended by ACOG, the WHO, and the CDC? I'm not afraid of that. I'm afraid of patients going through heartbreaking situations where babies, worst case scenario, don't have a brain or a skull, but also the many complications that come along with conditions like spina bifida. That's what I'm afraid of, not the liability of talking about folate versus folic acid.